Welcome to Duke Spine Institute live stream. I'm Dr. Duke Majin. It's Tuesday, March 11, 2025. Our patient comes from Colorado. So he is a snowbird. He comes from Colorado to Florida. He found out about Duke Spine Institute. His wife is a nurse. And he's here because, well, he's having horrible back pain and it's going down his right leg. When I did his assessment at Duke Spine, we used what's called the Duke Spine exam, and we found out his pain was coming from two places. The first was the L5-S1 disc, which is damaged, degenerated, and the second was the piriformis muscle on the right. So he's got two problems: disc pain, piriformis pain. And the disc is not just causing back pain, but it's also pinching his nerve, the sciatic nerve, L5 nerve root, running all the way down his leg. And he's got weakness in the leg. He has a spondylolisthesis at L5-S1. He does not want a fusion. We talked about it, putting a cage, decompression. He wants less invasive, and that's what we're doing. So we're going to try the Duke laser disc repair at 5-1, even though he has a grade, he's got a grade 2 spondylolisthesis. So we are actually placed our needle into the disc, and if you look at his MRI, the nerve root is getting just crushed on the right and left both. But he only has right leg pain, but he's got weakness on both sides from pinched nerves at L5-S1. So I'm going to try to make some room in there for the nerve root, get the pressure off the nerve root, buy him some more time. He does have a crack and a fracture through the pars, which is very common. You can see that on the x-ray. Jordan, show us the pars defect. It's called a defect. A little bit lower, or to the right, a little bit, no, up, right there. See that? At the bottom there, go, no. Up, stop, right there, to up to the right, there. No, you passed it, right there. That is the crack, and that whole piece of bone right there should be lined up with the bone where the arrow is. Go to the right, there. It should be lined up on there. So it's clearly slipped forward. We call that a pars defect and a spondylolisthesis. Very common problem. But, you know, half the doctors say it needs to be fused, the other half say it doesn't. I'm actually in the group that says it doesn't, as long as you do endoscopic spine surgery like we're doing. But if you're going to go back there and take out bone and ligament, then it needs to be fused. I used to fuse these all the time. We're not taking bone and ligament out. We're coming through the side. All right, if you have questions, feel free to ask me. We're going to be doing this for a little while. We're going to finish the disc, and then we're going to go and do a second stream on his piriformis. It'll be a right piriformis muscle release. Again, our patient comes from, where? Colorado, sorry. But also Bushnell. So, all right. Now, one thing I want to tell you is that when people have chronic back pain, there are more than one cause, right? The disc is one issue. Facet joints are another cause. Piriformis and sacroiliac joints. Those are the four most common causes of back pain. Henry, why don't you show the audience a video while we get started on the common causes of back pain, the 30 most common causes.
Of course.
I'm Dr. R. Duke Majin with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. And welcome back. You can see from our video that there's more than one cause to back pain. There's actually 30 causes of chronic back pain. And we've listed out all 30 causes, but here's the thing to keep in mind. Not all 30 are equal. They don't happen in the same frequency. Some of those causes are far more common than others. For example, the disc is by far the most common cause of back pain. Disc problems. And that's what this patient has. We're trying to get the scope working. Looks like there may be some water here. Huh? What's happening here? How come it won't go all the way?
That's right.
All right, let's see. So the camera looks good. Oh, something happening with the other. No, that's clean. Why is this not going? See that?
Completely?
It should go easily, right?
Yeah, should be more easier.
Is it bent? Strange. All right. We're just trying to get our scope working. Grab another scope.
Is the focus or not?
Oh, something's wrong with the scope.
Yes. Lights on.
I don't need to say anything, do I? What? We're Luis, do I need to say anything?
No.
It's another scope that's broken. All right. Laser.
Ready?
Any questions, Henry?
Yes, we have a question coming from Lanu on YouTube
Sure.
asking, I try to read your mind. Sometimes you are in a good mood and sometimes in a bad mood. How do you overcome these emotions?
Well, I'm very reactionary. When people are doing what they're supposed to do, I'm in a good mood. When people are not doing what they're supposed to do, I'm in a bad mood. It's difficult. I find the best way to overcome my emotions is to let them out on people. Makes me feel better. On the people that deserve it, to be honest. Which is why we have some turnover in our staff. But I'm okay with that because the people that are receiving the rage and frustration are usually the ones who deserve it. And there's really only one way to, if you're receiving my upset, anger, frustration, it's because you've done something you're not supposed to do. And, people can't make a perfect job every day. I understand that. But when I see things that are out of place, then I know there's something really wrong. And they're not doing their job properly. There's very little that upsets me. The thing that bothers me the most, that's a big piece of herniation. Check this out. Henry, show this.
Of course.
This is a huge piece of herniation that just came out. That's the main one that was pushing on the nerve. Now look carefully here. You guys see this?
Yes, we do.
All right. Can you make out the little red area right there?
Yes.
That's inflammation. All right. And then you see the kind of, darker areas here. That's calcium. Okay. Calcification. So that piece of herniation his body has been trying to get rid of it by using inflammation, which I tell you, it's never going to work. So what makes me happy is when people do what they're supposed to do. Okay. And the other thing that really bothers me the most is lying. When people lie and they're false or fake, nothing bothers me more. I'm very honest. I'm very open. If I make mistakes, I admit it. I made a mistake. I've made too many mistakes in my life to even tell you how many. But I think people need to be honest about their mistakes, and they need to work towards fixing them, making themselves better, self-improvement. And my employees, when they make a mistake, I want them to reflect on their mistake, admit their mistake, and figure out a way to improve so that they're not making the same mistake again and again and again. That bothers me when people are not honest with themselves or with me. And it bothers me when the medical community is not honest with patients. So when doctors are lying to patients, that bothers me a lot. I think doctors have to be honest, and I see all the time doctors are not honest. They basically lie to patients to do things that are best for the doctor or the hospital, or basically for the doctor mostly. So Henry
Yes, sir.
has something special. Our movie is almost ready for distribution,
Yes,
and we have our preview of the movie
that we do.
called a trailer. And you guys have been asking about it for a long time. So we have just received the trailer, and we're going to show it to you right now. How long is the trailer?
The trailer is about 2.5 minutes. Just I can get it going in a few moments. Just give me some time.
All right, so I'm going to give Henry a moment to get the trailer loaded. But basically, our movie series is called Spine Scam. And it's really about the spinal industry and how it's scamming the patients. The patients are the ones being scammed, not the doctors, not the hospitals, patients. And patients are unaware of the scam. And so what I'd like to do is expose the scam, expose this dishonesty, the lying and corruption. All right, so why do doctors lie to patients about what's best for their spines and their back pain? They lie because basically financial gain, their own financial gain, not the patient's financial gain, but the doctor's financial gain.
Allegations
So I'm
have
gonna be
surfaced
very
pointing.
unpopular among my colleagues when this movie comes out, but the movie
Allegations have surfaced pointing to a major
is,
bribery scheme.
quote unquote fiction, because I can't have real characters, real life people characters. So it's a fictional movie, but it's about a subject and topic that's not fictional, it's real. And what's happening in the spine industry, I'm trying to capture in this movie series called Spine Scam. Cannot seem to get that piece. So I want to bring back honesty and integrity to our profession. I want to bring about change. And the only way change is going to happen is if the public demands it. In other words, if the public is okay with doctors lying to them about the best treatment available or their care, if the public's all right with it, then we're just going to keep having this charade of lies from the doctors to their patients. And this is bigger than just spine surgery, by the way. This is in every field or specialty of medicine. Unfortunately, we're seeing these issues arise. I'll give you another example. In OBGYN, all right, my father was an obstetrics gynecologist. There's something happening in OBGYN that's a scam. All right, there's something called a bladder stimulator, and these doctors are, the surgeons, OBGYNs, are promoting putting them in patients, every patient they possibly can. As women get older, they get urinary incontinence, so they make tremendous profit, these doctors, on these bladder stimulators and putting them in patient. They're no different than a spinal cord stimulator, which is extremely profitable for pain management doctors. So what's happening is these technologies that don't work are being promoted for every single patient that has a very common chronic medical problem. So people with back pain, these companies are promoting using stimulators, thank you, which don't work. Okay, they don't work for back pain. But that doesn't stop these doctors from recommending them and putting them in. And that's what's happening. So go ahead and, Henry, show them the preview for the movie. You guys are seeing it for the first time. We're releasing it to the public, the trailer for the upcoming movie.
Allegations have surfaced pointing to a major bribery scheme between medical providers and spinal surgeons. What we uncovered is potentially criminal.
This consulting package is worth $300,000 to $500,000 a year.
You know how this works. You lie to people in pain to make a buck. And I give you tropical vacations and pleasure cruises to make it worth your while.
Your fusion technique is looking very good. You stay focused and disciplined, you'll go a long way in this business.
Business. And I'd like to thank my friends Bruce and Rhett at Globazon for helping to develop these exceptional products.
I wonder how much that fucker makes from those implant companies.
You think he's on the take?
You know he is.
We need every one of our residents to be loyal to the program and loyal to the Globazon brand.
There's a new aspiring neuro at SD University Hospital. I want you to move in and land him.
And how far do you want me to go?
Whatever it takes.
You have lumbar degenerative disc disease. Spinal fusion is the only option.
Lately, I've noticed the hospital seems to be doing way too many surgeries. Like we're doing it just for the money, not because it's 100% the right call for the patient.
Your little prodigy's become obsessed with some sort of alternative laser treatment.
It's better for the patients.
For your own fucking good, drop it.
I feel like they're all pushing me to do what's best for them, not necessarily what's best for me.
Why can't anyone just do the right thing?
We do not need some morally virtuous renegade poking around.
This could become a complete shit show.
What about our pledge to the industry?
What about the welfare of our patients? What about our own moral code?
And if he doesn't listen, then cut him loose. Hey, remember when that douchebag Dr. Bob used to be an idealist? Now he's just a capitalist.
Capitalists like money.
Yes, they do.
And there it is, Spine Scam, the movie I've been talking about for over a year and a half. Finally, the movie is done. The trailer is right there. You guys just watched it. And we're going to do our live screening of the movie this Sunday.
Yes.
And Henry has the details. He'll post them. He'll put them on our Facebook channel.
Yep.
On our LinkedIn
Yep.
and X and everywhere. So if you want to watch it and you want your friends to watch the movie will be previewed this weekend on Sunday, 4 p.m. Eastern Standard Time.
Perfect.
All right, let's see. We're done. We've cleaned out the herniation. That was the big piece that came out. And any other questions?
Yes, we have a question coming from Lanu, once more on YouTube, asking a question about small pieces of herniation that are taken out. Do you have a lab that does biopsies?
Yeah, we send these pieces off to a lab, and we have a pathologist just look at them. And the pathologist will just comment, just they're fragments of disc herniation, that's all. So there's nothing earth-shattering about the pathologist report. But we like to send them anyway. All right, folks, we are done. Let's go ahead and end, and we'll be back shortly for a piriformis release.